I think it'll have a marginal benefit for the teachers and the adults exposed to children breathing over them. That must be a good thing, even if the benefits are relatively small. So I would say it's worth doing. On the other side, of course, there's the discussion about how will it affect the children who are forced to wear masks all day, and I'm sure it won't improve them much. But I think on balance, it's probably worth it, if only to stop teachers and other adults working in the school going off sick, which is then going to mean that teaching will have to go online.
Cole, the founder of Us For Them, earlier on, and of course Liz Cole's main objection was that it was bad for the kids. But you make a very good point. Staff absences are really at the heart of what the government's trying to avoid here, so that children can continue with their education, which they've missed out on so badly these last 2 years.
I think it's worse for kids to be away from school. And if we can keep them in school, bearing in mind what that will do to their parents, who would then also have to be off school to look after them, I think the advantage to keeping children at school with a mask is better than having no school at all. And if we say that keeping kids at school is the most important thing for their mental health, then I think we should pursue that in favour of other factors, recognising that none of this is good. It's only which is least worst for the kids.
Face mask previously advised in communal areas for pupils in Year 7 and above, but now this advice extending to lessons as well. And it's worth reiterating the point that England, the only one of the 4 UK nations which didn't recommend masks in classrooms. What are your views on this other part of the initiative the government's pumping forward now, these 7,000, I beg your pardon, new air purifiers being distributed to schools where good ventilation is difficult? Is that a good thing as well?
It's a great idea, but unfortunately there's nowhere near enough of them to make a material difference to all the schools and all the classrooms across the whole of England. I mean, very nice for those 7,000 classrooms, but it won't solve the problem for all the other classrooms. So I'm not poo-pooing it. It's just, I don't think it's going to be enough to make a huge difference to all of the kids in all of the classes.
It backs up the argument for masks again, doesn't it? In terms of kids and booster vaccines, what's your position on that? Should kids get their boosters?
I think we should be vaccinating everybody where it has been shown to be safe for that particular age group and that particular kind of person. So I'd be keen on vaccinating anyone that the evidence supported vaccination, certainly down to 12. And there's a good argument for doing it for younger kids too. Anybody who doesn't need to have COVID, or worse, transmit it to other people who really don't need it, the better.
And what's your take on where we are with this Omicron variant? Reading the data, reading the science in your capacity as a GP, do you think this could be our silver bullet and our route to herd immunity?
I think the more people we can vaccinate, and the slower we can keep the peak of numbers of cases, if only because of the effect it's going to have on hospitals and all sorts of other service provision around the country, the more we can do that, the better. Omicron is clearly less likely to kill you, certainly if you're vaccinated, but it will still send an awful lot of people to hospital because it's so infectious. And more than that, it'll keep doctors and nurses and other healthcare workers out of hospitals because they're off either sick or a contact. The same applies to everybody else. Wherever you are, the last thing you want is to be not at work. And the people you deal with, they don't want you off work either. So all we're doing is blunting the peak to stop too many people surging with illness, even if it's not serious illness, before society can't function anymore.